guys. Welcome to episode 4 of the Chronic Illness and Mental Health series. For episode 4, we have Rachel. This is
Hi.
Rachel. Hi.
Hi.
So why don't you give us a quick background of what you have going on?
Okay, so I've had chronic pain since I was 12 years old, so now I'm 18, so it's been 6 years since I've had chronic pain. And it all started when I was doing dry land at swim practice, and I fell off the monkey bars, and I landed on my wrists. And it's like the pain has moved throughout my whole body because it's shift my spine and everything. And so I have I have no correct diagnosis. I have a diagnosis called amplified muscular pain syndrome, but that's really just a bullshit term for we don't know what's wrong with you. And so I go to a chiropractor and I'm trying to do all these holistic medicine type things now to help myself.
Okay, that's interesting. So you hit your wrist and then it just kind of...
Yeah, I can actually, here, let me show you the x-ray of my spine.
Oh my goodness.
Yeah. So I have this tiny, I don't know if you can see here.
I can kind of see.
Brightness. I have
Okay.
this tiny, see that little curve? Like, your spine's supposed to be like straight and stuff. That was my curve. And I don't have like scoliosis or anything. It just because of the fall, it messed up my spine and like my hips are all uneven. But yeah, I have like this little curve in my spine. And like, it's just, we think it's like a big problem, like a big reason why I have other problems, but there's also a lot of other things why I have my problems.
Oh, wow. That's actually pretty interesting. But before I get distracted, I'm going to go into the mental health part. Yeah. So before you were injured and got the chronic pain, you didn't have any mental health issues before 12, I guess. Yeah.
No, I was actually like a really like bubbly, like outgoing person. Like I didn't really I didn't feel like anxious or anything before I got injured.
Never, right?
Yeah.
And you were pretty young too, so you're just like happy go lucky kid is what it sounds like.
Yeah, I was like, I was a swimmer and I I don't know, I swam my whole life and just always had fun. I don't know. I just wasn't anxious.
Yeah. So were you kind of athletic too with swimming?
Yes.
Did you do anything else?
No, swimming's, I danced since I was a dancer when I was like 4 or 5 years old, but no, I swam. That was the thing.
Okay. So then when you did get the chronic pain, did you lose any of that?
Yes, definitely. I definitely became a shell of a person.
Yeah.
Let me see, like I would just be on the couch all the time crying because I'd be in so much pain.
Mm-hmm.
And then I lost all my friends. I was probably the most depressed part of my life was from 15 to 17 until I got 2 best friends in senior year and they pulled me out of my funk. But I just have had so many anxiety around doctors and just life in general.
Yeah. So you said you were most depressed at 15 to 17?
Yeah.
And then you got the chronic pain at 12, right?
Mm-hmm.
So how did it kind of build up to that?
Well, it kind of just started when I was 12, the chronic pain wasn't terrible. It was only in my wrists and my knees. And I was still trying to swim. I was trying to be active because there was nothing wrong with me. Everything came back normal. I was trying to live a normal life. And then I slowly at 13, 14, I started stop swimming. That's when I really stopped swimming. And I started losing contact with friends and 14, 15, it was middle school time, you start getting bullied. I was starting to get bullied for my what are they called? When you have your I forgot the word for school when you have when you can use your iPad or whatever and people take
they're accommodations. It's
accommodations. That's the word. I forget words all the time.
Yeah, no, I do too. All the time.
Yeah, people would make fun of me for using my accommodations and it kind of just made me go into myself and just ignore the whole world and just sit in my house and do nothing.
Yeah. So I guess what were those really bad days? Kind of what did they look like for you? How did it feel? And
The really bad days, I was just numb. Like
Yeah.
I ignore my emotions a lot. Like I've learned through this like practice that I do called NET. It's called neuro-emotional technique. And
Hmm.
if we do like the alternative medications, I can talk more about that. But like I've learned that like I like push away my emotions and I like I don't feel, and I just like I don't feel my emotions. So like my highest point, like my more not my highest point, my deepest point in like depression, like I think I wouldn't feel anything and like
Yeah.
I'm numb. And then like if I did feel things, it would be so overwhelming that I would just scream cry.
Yeah. Actually, I mean, it's not funny, but it's funny you say that because I'm the exact same way. Um, so I guess when you get super, super low, is that when kind of the emotions flooded out, or was it more numb? Like, what was the difference of the numb and then
The numb.
all of them
Uh,
just like flowing out? Like, what points were you at for both of those?
if I was like ever alone, like I was just really numb. And
Hmm.
then if like I like heard anything bad or like someone said something bad about me or whatever, like I would just start spiraling in my head and like telling myself like how like bad of a person I was. This sounds so bad, but like I would just like reprimand myself and be like, "You're such a
Yeah.
bad person. Like you don't deserve any of this. What it like?" I would just be so cruel to myself in my head, and I would spiral so hard that I would scream cry. Like
Yeah. No,
it's
I get what you're saying. I've done the exact same thing, and it's hard when you're already at that point to not
yeah.
just rip yourself apart already because you're already at such a fragile point that it's like you're gonna rip yourself apart. I feel like
Like I can
if
give you like example of like one of my scream cries is like it was
yeah,
like the night before graduation, my graduation, and I was just thinking about how like I have like a really like hard like time like thinking about the future because like all like the joy like I don't know what I'm doing with my life, and so it just like
mhm,
that's a very big like stress in my life. And so
yeah,
like I just started spiraling the night before like my graduation. And like I remember just like being holed up. Like I was sitting in my kitchen, like everyone was around me. I just remember sitting in my kitchen like curled into myself and like telling myself all these bad things. And then like I just started crying, and then someone asked me what was wrong, and then I just freaked out. Like
yeah,
it's really bad. Like it's really embarrassing when you do it in front of people, but like it always just like happens right in front of people. And
yeah,
that's really embarrassing.
yeah. I mean, you can't control it. It's just one of those
Yeah.
things that's like I feel like that's what happens when you don't feel emotions at all. Because I'm the same way. Like you're just numb most of the time, and then
Yeah.
something will just like push you over, and it all comes flooding out. Everything that you repressed, everything. It's just like an explosion. And I don't know if you watch WandaVision.
No, I have
Do
not.
you? Okay, okay. I was gonna make a reference
You can
because
make the reference.
okay, her character is kind of the same way. Like everything comes flooding out of her into this like
Yeah.
it's like they call it chaos magic. So it's like when she feels super low and like those same feelings, everything comes flooding out of her. But instead of emotions, it's magic. So it's like the same thing.
I wish I had that instead.
Right? I wish too.
I want
So
the
I
chaos
feel like
magic.
that's a really good connection.
Yeah.
But she's the exact same way. Um, do you have any other examples, I guess, too, from
Any
that?
I remember like I get like panic attacks too, instead of like if it's not like it doesn't always get to the point where I scream cry, but like I like panic attacks. And
Yeah.
like just trying to think.
Yeah.
Like I like my whole body just like shuts down, like it's like in an instant, like I can't breathe. And
Hmm.
like I can breathe, but it feels like I can't breathe. And
Yeah.
then like I don't know, I just don't feel anything. I just feel like I like can't breathe. And like I
Yeah.
just start like I don't even know how to explain it. Like just like my whole body just shuts down.
No,
And like
I know you're saying. I think other people will know what you're saying too, because
yeah.
they definitely have dealt with it too.
Yeah.
Do you have anything that kind of triggers those, or have you noticed
Um
anything that does?
a big trigger for me for like panicking and stuff is um like going to I remember going to my like chiropractor, and this is like after like going all to like, all these doctors telling me, oh, it's all in your head. Like there's nothing wrong with you. Like we literally can't find anything wrong with you. Every test comes back normal. And I remember, and like I stopped going to doctors like after 15 like years old. Like I just stopped going because I couldn't deal with it. And
Yeah.
then my mom finally got me to go to a chiropractor near her, like, because like she really trusts them because she like works right next, like her store is right next to them, and so like she really trusts them and stuff, and so she wanted me to go to them, and I love them so much. And like I remember going to my first appointment, I was so nervous, like I was already crying already, and then the moment she said, "We're gonna get you x-rays," I flipped out because I was like, no, because you're gonna find something normal and you're gonna send me on my way. Like I can't. Like I like flipped out when she said, "We're gonna get you x-rays," and I was no. I just still I don't like tests. Tests are a really big thing.
Yeah.
Like medical tests are just a really big thing that triggers and sets off everything, like nervous wise. Other triggers, I don't know, anything can really just set me off. Like, I don't know. Like, it just depends on my mood and like how I'm feeling. I don't really like have like specific triggers, I think. I just, whatever like I'm feeling, and like it just like, I don't know, honestly.
No, I know what you're saying. Like, I feel like with mental illness coming from chronic pain, it's all so random. Because chronic pain isn't one thing, it's also random. So if it comes from something random, it's going to be random. I feel like that's kind of how I see it too. But I was going to ask about some of the lower days again too. Do you ever feel like you can't get out of them, or that there's going to be no end to them, or they're just, or do you feel like you're in one kind of all the time, or do you kind of have highs and lows, something like that?
When I was definitely, when I was like 15, 17, like I definitely felt like I was always in a low point. Like I didn't, like, I was always definitely in a low point. I wasn't happy. I wasn't anything really. Like that's how I felt. And definitely now I definitely have risen a lot higher, and like being happy, and like I actually have like friends that I hang out with, and like I'm more content with being by myself, and like just learning how I am as a person, because I haven't really had the chance to grow as a person, because all I've had to worry, like I've had to worry about how my joint pain is going to affect me, and I've never had to like, I never could grow as a person. And so I feel like I'm trying to like, I'm actually growing as a person now. If that makes sense.
That makes a lot of sense. So before now, did it kind of just take, like, your mental health kind of just took over along with the joint pain? It was just like couldn't do anything really?
Yeah, I kind of would just like, everything's such a like a blur. Like I like doesn't even like feel like it's real. Like I don't know, like I blacked out through like half of it. Like I just like, yeah, I think the biggest thing that like helped me is like listening to like loud music. Like that would always like make me the happiest, because I would just dance around my house and listen to loud music, because like I'm also like home alone a lot, because I'm the youngest out of three, and my sisters would always like go hang out with their friends and stuff, and I would just always be home alone while my parents are at work. And so just I always kind of felt like I'm like an only child kind of. And then also like my sisters are now moved out, and so
that's kind of nice though, to kind of have the space to yourself. Or did you kind of, would you prefer having more people around most of the time, or did you like having the alone time?
I go back and forth between this, because I'm just like, I love being alone, but at the same time I hate being alone. Like I love being with the right people. I think that's what I need.
Yeah, that's hard to find too. So when you kind of lost some friends, then did you feel like they weren't kind of the right people once you got chronic pain? Did that kind of show, or?
I just like, yeah, I guess like if they didn't want to be in my life and like help me go through this, then I don't need them, you know? Like it's really hard, because I lost my my best friend since I was like 4 years old. Like we fell out of touch like really badly, and like that was a really hard loss, I would say, like one of the hardest loss of my friends. But like I lost all my swim, like, because like I'm a swimmer, and I like all I did was swim, and so like I only had swim friends, like, and like if you stop swimming, you don't have those friends anymore.
Yeah, that's how it goes with sports. So then I guess going through that period, did it lead to like a lot of isolation and just not being able to contact people, or not having a lot of people to contact and just being extremely isolated?
Yeah, I was extremely isolated, and I don't know, I just didn't have anyone in my life, you know, like you know how you have like your person or whatever that you can always like contact and stuff. Like I don't really have that as like in my life. Like I never really had that.
Yeah. So how did you deal with that? Was that hard to deal with going through it?
I would say yes, because like, you know, sometimes you just want to like call someone and cry, but I also always kind of end up being my own person. Like
Yeah.
I'm the one who like gets me out of my own panic attacks. Like I will like freak out for like I let myself freak out for like a minute or two, but then I reel myself back. Like I'm the one who calms me down. Like
Yeah, that makes a lot of sense.
I learned how to be my own person, basically. And
Yeah.
I think it's kind of like good because then I don't have to rely on like I don't like rely I'm a very independent person in general. And
Yeah.
so I just like I think it taught me how to like become my own person and just not rely on people, which is a good and a bad thing, I think.
Yeah. No, I completely understand, because I'm like the exact same way. I'm extremely independent now, and it's just you kind of depend on yourself when it gets really bad.
Yeah.
So that obviously I feel like takes some learning, and you have to go through a lot to get to that point. So how did you kind of get to that point, or what did you learn trying to get to that point?
What I don't thing is like I just don't know a lot of this stuff because like I just never like thought about it, but
Yeah.
How did I get to that point of being my own person? I think just being so alone and like being the like I realized like I'm like I started going to therapy when I was 13 years old. I still go because
Yeah.
But I think I like learned like a lot from my therapist and like how to like be like come like more stable. Like he would always tell me to like just breathe. Like honestly, like that was like his biggest advice for me is just you need to like breathe and calm down and like learn that like if you just do your 5 like in breaths, like you're gonna change. Like that's gonna just help you like calm down. I think that so that was like a really big thing, like learning like just to like center myself and like ground and like find like tactics to help me get through the hard days. And like if like I'm ever in pain, like I just gotta like not push through it necessarily, but just be able to get comfortable enough to like do things that I want to do.
Yeah. That makes a lot of sense. And I agree with all of it. I like to do all that too.
Yeah.
I've learned the same things. So for therapy, do you like therapy? Because I know it's super controversial in people with chronic pain, chronic illnesses. Some people hate it, some people love it, and some people are just too scared to try it because they don't know.
Yeah, I personally think therapy has helped me a lot and I love it actually a lot. I think it gets me to be able to like get a different perspective on my life and be able to like change my mindset for better things, which I think is a good thing. Like I like getting different perspectives and point of views. It really like helps me like understand the situation and stuff. And so I think therapy has been like a really big thing like that like I've done. And also like with the chronic pain being undiagnosed, I know it's like controversial to say like it's all in your head, but I had this doctor tell me basically that what did she like she said that you like she wants me to get out of the mindset of like the way they say it's all in your head is like bad. Like she regrets that. Like she understands like the way like the way it's like the way they I'm sorry, I'm stuttering.
No, it's okay. I know what you mean completely. It's hard to put into words. I can't.
Like the like putting like the way that doctors condescendingly say, oh, it's all in your head and there's nothing wrong with you. That's not the way to approach it. Now there could be things wrong like mentally wrong that's causing you to like physically have pain, which they think is going on with me is like my emotions cause me to have pain too. Because that's a lot like the whole point of like NET, like the thing I talked about. But like I don't even know where I was going with this. Oh, she said that we need to like she wanted me to change my mindset and be like, it's okay for it to be all in your head, but there's still ways to like treat it. Like there's still ways to like get out of it being all in your head.
Yeah.
Not all in my head, but it's manifesting some in my head, if that makes sense.
That makes a lot of sense. I feel like the same way that I've kind of developed some things that are purely just mental that I've been super dismissive of too over the years. But yeah, I always try to not forget that it all came from something real too.
Yeah, I think that's like, I know it's like such a controversial thing to say that it's like mental things, and I get it, because like a lot of time it's not. And I think in my case it could be like, it's a big contributing factor that it's in my head, but but it's also, I want to put it out there that it's not a bad thing.
Yeah,
like it may like, don't listen to doctors that are like mean about it and say that it's nothing wrong with you, but also realize that what they're saying might be correct. It just, the way they're going about it is really wrong.
Yeah, I can agree with that, because I've had, actually the person that made me see that was my old physical therapist. He was like, you have all this physical like stuff wrong with you. We know that. You have blood tests, you have all this stuff. We know you have the physical aspect. But he's like, you're completely ignoring the mental aspect, and there's definitely a lot coming from there. And he said it in the way of still acknowledging physical, but saying you also have to acknowledge the mental. You can't just leave it on its own, or else you're not going to heal completely. And I was like, okay.
Yeah, I know.
You're
like,
right. But I didn't want to believe him.
You have to, like, to have a healthy life, you need a healthy body and mind, I feel like.
Yeah, I think so too. It's just so hard to find, because so many doctors will dismiss you of one or the other.
Yeah,
and
I know.
It gets irritating.
Like going to the chiropractor, I get dismissed all the fucking time, because
really,
like even my dad is still like skeptical of it, and like my whole immediate like not my immediate family, my like outer family, like my grandparents, like just don't like understand it, like because like, you know, like going to a chiropractor is like such a like I don't know, like hush hush thing that like they don't want you doing, because it's like, it just like has like a lot of bad reputation, and like it's really not. Like it's actually like, if you go to the right person and they know what they're doing, it's actually like really good.
Yeah,
like
I do love chiropractors.
Yeah,
I just haven't been to one in a while. I replaced it with physical therapy, but I did love them before, and then I found a physical therapist that does chiropractic things, and I was like, might as well get both. So
yeah,
do love them. And I'm glad it's helped you. Do you think it's helped like the mental aspect over time too, a little bit?
Yes, I think it's definitely got me more confident about going to doctors, and like being more confident in myself. Like, because like the first thing my chiropractor ever did when she first saw me, she apologized for everything that's happened to me, and she wasn't even there. Like she didn't do anything to me, and she's the one who apologized for all the like crap I went through. And like that was like a really like eye-opening, like, oh man, I'm gonna really like this like woman. Like I think it's really helped me mentally become like stronger as a person, and like not be so afraid to do things.
Yeah, because you finally have someone that like believes you. It's like refreshing, and you don't have to fight against them. You're not trying to prove yourself. They're just like, I see it, I get it, it sucks.
It's so refreshing, because like I literally could just like hop right in there and be like, something's hurting me right now, can you fix it? And she'll gladly fix it, because like she even knows, oh, it might not be physical, but she'll still check it to make sure. Like that's like the best thing, like, because I get like rib pain and stuff, and so like it's really weird, because like I don't like, sometimes I don't know if it's sore pain or if it's like the chronic pain, and so I'm just like, can you check this real fast, because it really hurts. And normally it's something, but
that's why I love chiropractors and physical therapists, but they have to be good. Like you go to a bad one, you're not gonna enjoy it. You got to find like a good experienced one, I feel like, and luckily I've only seen those ones and I love them, but I know there are bad ones out there. But chiropractors and physical therapists are probably my favorite in the medical field of all of them.
Honestly,
they get it. Like they're just so understanding, and they're smart.
they're the ones who actually want to help.
Yeah. I mean, that's their job. They're like, they don't like doctors either. They typically they do not like doctors.
Yeah.
At least that's what mine used to tell me all the time.
Yeah.
They don't like doctors, but they're super understanding. I feel like it's really nice to have that.
Yeah, and I've been to like three different physical therapists, and like, well, yes, I always found it to be more like a band-aid than like anything that really like helps.
Yeah.
And like I appreciate the physical therapist and like all they did for me, but I think chiropractor is way better for me,
Yeah.
like personally.
I love both, so that's why I was like, I'm going to a PT that knows how to do what chiropractors do, because some PTs don't. Some don't do the adjustments, they don't know, and some do. So I mean, if you can find both,
yeah,
good. But
and
it's
like,
just some PTs just don't have the experience, and it's really bad. It's just it's not cool.
Yeah.
I've heard some bad experiences, and I'm like, oh my god, that's terrible. But got to find the right one.
Yeah.
And I do love chiropractors too. I think they're really, really nice. So I guess with going through like your doctor journey and finding someone that will believe you, I think kind of some of the stuff you said is kind of like it's medical PTSD.
Yeah.
Right. For sure.
Definitely.
So what were some of those experiences like, and how did they affect you mentally seeing them?
The bad doctor visits? Okay.
Yeah, the ones that like kind of give you that medical PTSD of like,
so
like when you went to see the chiropractor and the x-ray, you were like, no way.
So actually, like, I feel like my mom remembers them more than I do because I kind of like blacked out during most of them. But the one that really sticks out in my brain is the very last doctor I went to when I was like 15. So, or 14, I don't know. I was in middle school. So I live in Florida, and so I went to UF Medical Health. Like I was sent to go to see the specialist. I don't know what he specialized. I can't remember what he specialized in. That was a long time ago. But he was a specialist, and I just remember him being like really like condescending and being like, I remember like the first, because I used to call it like joint pain because like it'd be like surrounding like my joints and stuff. And so I remember like the first thing he'd said to me was like, do you really have joint pain in all your joints? And I was like, well, it feels like I do. Like it's literally the first question he asked me, like, do you really think that you have joint pain everywhere? Like you have this many joints, like how can you have pain? I'd be like, sir, it just feels like I have pain everywhere. I'm sorry. I'm like, and like I wish I stuck up for myself, but obviously like I was like 13, 14, 15.
It's
like,
hard at that age. Like you like
it's really hard and you don't know what's wrong with you. So it's like, and doctors scare you, like you think they know everything. And so it scares you. But so, yeah, I remember the first thing he said to me was like, it's impossible to have a joint pain in every place. So I'm just like, well, it's happening in a lot of places. Like, I'm sorry, but like I feel it in my fingers, toes, hips, knees, ankles. Like, what do you want me to say? Like, and then he just kept on talking about my acne. Like I remember him like mentioning like oh like get some witch hazel and like that really helped my daughter and like clear her acne. And I was like, sir, I'm not coming for you for a dermatology appointment. Like I'm not here for that. Like I will go to my dermatologist if I want to clear my acne. I don't really care about my acne right now. Please just focus on what's wrong with me. And then he got out like the ultrasound machine and he had me lay down on my stomach and he just scanned one part of the back of my knee. Like he literally just put the wand on the back of my knee and was like showing my mom like, oh, there's nothing wrong with her. Like see here, like this is compared to her knee compared to a good knee, and they're like the exact same. So I'm just like, and it was just like he only did my knee. Like he didn't do anywhere else. And like I don't feel pain in the back of my knee. It's in the front of my knee. Like
that makes
it makes no sense. Like it made no sense. And he's the doctor who gave me the umbrella term amplified muscular pain syndrome, and I think he just gave it to me to give me a diagnosis. And I'd rather he've not given me a diagnosis. Like I don't want that. So
That you just blew my mind with the fact that you went for joint pain and he brought up acne, and I just can't. I can't get over that.
I get like where he's coming from, but I'm just like, sir, like I don't care about my acne right now. I want you to focus on my joint pain. Like I don't care.
Yeah, I mean that's extremely dismissive in itself. It's just like ignoring what you came for.
And I think I was extremely dismissed because one, I was a child, and two, I'm a female. Like I think that's the greatest thing I was dismissed for is like you don't believe children, and females always get dismissed. So like
yeah, exactly.
And then like that was like the doctor that really set me over the edge. Like that's the doctor that I stopped going to doctors to. And then like the other ones, my mom says that like she hated the way like the orthopedic surgeon like handled me because like he was really aggressive and she hated that. And I blocked that all out. Like I remember going into his office and I remember him like starting the exam, but I don't remember the exam.
Yeah.
And like sorry, I just get really passionate about this like this stuff.
I like it. This is what we need. Because like it affects you so badly, and this is literally what causes medical PTSD. So it's like
it just like it drives me insane. Like it drives me up a freaking wall.
Yeah.
And then also another like medical thing. So my like chronic like not my chronic doctor, my chiropractor, like we're doing like a metal detox thing, like seeing like the heavy metals is a big problem in my like system. And like she was explaining to me like how like certain things can like cause like heavy metals into my system. And she like mentioned like how like she's like pro vaccines. Like I don't want to get that like messed up. Like this is not about like anti-vaccines. I don't want to put that out here.
Yeah.
But she was just saying how like the booster shots for vaccines I might have not needed because my body may have still hold on to it.
Yeah.
And so like all like I still might have had all like that metal from my other vaccines in me, and so I might not have needed and like I might have needed my booster shots, and then like the booster shots added so much more metal in my system that it like messed it up because it's also around the time when I got my booster shots that the pain started. So so that's also another thing that like really annoys me because she said that there's an easy way to detect if you need a booster shot or not. And like doctors just don't tell you because they just want the money. And that's like the thing that drives me up a wall is like I hate money. Like it makes everyone really greedy. And that's like a big thing I have with doctors is that they don't give you the necessary information to treat yourself.
No, of course not. Because they don't care. It's literally, they just do not care. There are some that do. Mine does. I have found, luckily, I know some people have found great ones, and it's a rare finding, but
really
for the most part, they just don't care. And they do stuff like that. Everything you just explained, they dismiss you. They don't give you all the information. They just ignore what you are coming for, and they're like, whatever.
And it messes up mentally.
Yeah, it's very badly. It causes such bad medical PTSD, I feel like. Like you said with the x-ray, like your reaction with the x-ray and the chiropractor.
And I wasn't even expecting to like cry. She just said x-rays, we're gonna get you x-rays, and I started crying. And like I freaked out because like I didn't want her saying, sorry, can't help you, you're normal, like there's nothing wrong with you. But apparently, like so we do the x-rays standing up because like that's how you like see like the curves and stuff, because apparently when you lay down it straightens everything out, and so that's like why they couldn't like see the curve in my spine because I've had MRIs, I've had x-rays, I've had ultrasounds, like I've had the works with like imaging scanning, and like she just like my chiropractor like doesn't, I don't want to say that she hates doctors because I'm not speaking on her behalf, but she doesn't like how like the doctors treat people, like how their treatment plans and stuff. Mm-hmm. And like they don't do it correctly.
No, they really don't. They don't do anything right. I mean, no offense, but full offense. But they do not do anything right. And they just, I don't think they realize their words are so hurtful. And just because you were told that so often, I mean, that's exactly why I think you reacted like that. Yeah. I do the same thing. My new PT, I was like super scared to see, but he's great and I love him. And luckily my friend is in clinical there, so I was just like, oh my God. And I had her, she sat there too while he did the eval, but I was definitely terrified.
Yeah.
Because it's a new not doctor, but new medical professional, and you have no
Yeah.
idea how they're going to react or what they're going to think. And it's scary. Like any new doctor, I'll cry too. I went to a cardiologist and I just started crying. I just walked in the building and started crying.
I was getting my wisdom teeth out. They had me on Valium. I still freaked out. I was still a mess. Like literally, you would go to you can send me to a dentist's office. Like not even like nothing to do with my joint problems. I still freak out. Like no matter what.
Yeah, it's a doctor's office. It's medical. It's just like
went to a dermatologist, started crying.
Yeah,
it's so bad.
I do the same thing.
Yeah, I actually have to go to a new general practitioner because obviously I'm 18. I went to a pediatrician before now. So now I have to go to a doctor. And so I told my mom, if she does not agree with what I do, like go to the chiropractor and stuff, like she does not like that, I'm leaving. Like I'm firing her. Like I don't need her in my life.
Yeah, that you don't. I do not think you should say if they don't agree with what you know, what you've been dealing with since you were a kid. Like they've known you for 20 minutes and they're going to say like, no, not at all.
I know myself better than you do. Stop it.
Exactly. And I think you seem like you're at a good spot where you would stand up for yourself in that situation.
Yeah, hopefully.
Hopefully. You never know. I feel like you never know.
I still might break down, but hopefully I might cry, but I'll still stick up for myself, hopefully, because I feel a lot mentally stronger going into this. Like going into this, I feel much more mentally stronger than I did even like 6 months ago. Because I started going to the chiropractor like 17, and that's like when things start picking up speed and start treating myself again. But I feel much more mentally strong. And I think a big thing is just finding a doctor that actually believes me.
Yeah, I think that's huge too. For confidence is once you see that someone does believe you, it's like, okay, then these other ones should, but they're just choosing not to.
Yeah.
Or they're not really looking all the way into it, or they're not doing what this person I know that believes me has done. And it's just, they make you realize that you're not making it up. But a lot of doctors seem to think that, which
sucks.
Is so annoying. And it just,
I just want to like sometimes get in their face and scream at them. Listen to me. I'm telling you a story. I'm telling you something about my life that's important to me. Listen. That's what I was gonna say that to any doctors watching this, or you want to become a doctor. Listen to your fucking patients.
Yeah.
Like
that'd be nice.
Be nice,
right? Because I don't. Yeah. I just don't think they realize the amount of literal like medical PTSD they cause. Like you shouldn't go normal people, like anyone without issues. They don't walk into a doctor's office and just start crying, but a lot of us do.
Yeah, I saw something on it was like Instagram, like the reels and stuff, like something that triggered me was I saw this like doctor video or whatever, saying oh, I hate it when my patients tell me stories that don't pertain to the medical thing or medical side. And I just feel like that's kind of stupid because I feel like if a patient's telling you a story that's important to them and it might help you figure out what's wrong with them.
Yeah, they're typically not going to tell you a random story.
Yeah.
I feel like all the stories kind of correlate to why they're seeing you. So that is, you may think it's not, but to them, it does relate to them.
And maybe I'm perceiving that wrong, and maybe they do get random stories that they shouldn't be hearing or don't really care about. But that's something that really set me off. It's just listen to your patients. I get it.
You can still listen.
I get it that you're on a time crunch and you need to see other patients, but also I don't know, it just really made me mad because it just made me feel like they don't you want your doctors to care, and if they don't let you talk to them and even I know they only have 15 minutes. I know it's hard because I see both point of views. It's really hard for me. I play devil advocate all the time, but at the same time, I just listen to your patients because what they're saying to you might save their life.
Yeah. I wish they would. I really wish they would. I feel like they see a lot of things that are important as not important too. Yeah. So it's at least try. Just try to listen or something or anything, because they're causing, I feel like, a lot more damage than not, especially mentally. I mean, based on everything you just said, those experiences with your doctor, I'm like that is the major cause of what medical PTSD is, and it's not fair for people to have to go through that.
I didn't even like realize until like talking to you how much like actually like I think the doctor like PTSD or whatever like has caused so much more anxiety in me. Like I didn't like I never like put two and two together. Like I knew, but like you like it didn't really like dawn on me until like you saying it. That's probably like a really big contribute like contribute. Oh God, I can't speak.
It's okay. I can't speak words either, ever. Half the time.
Yeah, it's just like a big factor in why I have anxiety. Like it just kind of like, oh, that makes sense. That really makes a lot of sense.
Right.
You saying that.
I mean, it would make sense based on just what you said, like the doctor's dismissing you. And then when you said that you went into the x-ray crying, so you didn't want her to say nothing's wrong, like she wasn't going to see anything. Like that's coming from what you've experienced in the past. And it's just, I think I've heard a lot of people deal with very similar things, where so much of what doctors have told them, they've just brought with them to every other doctor. And it's hard to go in with a like blank slate.
Yeah.
You just bring in everything from the past doctors and you're like, oh my God, they're going to say this. They're going to do that. They're going to do this. And it's just basically a lot of doctor anxiety.
Yeah.
A lot of doctor PTSD, a lot of terrible things that come with it, I think.
I think also like a big thing is that like doctors like feel like they know everything, and so they're very condescending. They come off very condescending. And I don't know if they mean to, but like they just come off like as that like student that like, oh yeah, I know everything. I know everything. What you're saying is not correct. So I'm not gonna even listen.
They definitely do. Like I remember I saw a doctor for thoracic outlet. My dad tried to tell him that was thoracic outlet, and he was like, no, she's too young. Like I know my stuff. She doesn't have that. And then we were in and out in 5 minutes, and my dad was ready to like fight him. I was like,
yeah, I was about to say that. Like I remember your story about like how like you like have like you found your diagnosis, like, and I appreciate like the doctor you have now is like, oh, it's probably not this, but we'll still test you for it. Like that's something that I appreciate so much. It's like, oh yeah, if you don't think it's like the right thing and like, but you still like, it's still like a possibility. Like just because it's really rare doesn't mean it's not a possibility. Like
yeah, exactly. And that's how all doctors should look at it.
Yeah.
Because he was like, he's like, you're very young. This is rare. Typically, just by looking at you and ignoring symptoms, sure, yeah, it probably isn't that because how young you are. But he's like, all the symptoms match, so why not test for it? So he tested for it, and he's like,
and you're willing to test for it. Like I think that's the biggest thing too. Like if you want to test for it, you should be allowed to test for it. And it makes sense.
Yeah, that's how doctors should be.
Yeah.
They're not. It's not like that. They're so dismissive, and it bothers me. That's why I only like 4 doctors.
It drives me insane. Like I can't. I don't like you. I don't like any other doctors if you don't try like listen to me. I'm sorry. I just don't like you.
Yeah, and they cause so much damage to the people going forward. Like, and I think it can really damage trying to find an outcome for what you do have going on, because you're going to start kind of suppressing things too, and then you're like, they're not going to believe me, so you don't tell them everything. And it's just like that's a problem.
For me, example, like 6 years undiagnosed with anything, and I like only went to a doctor that actually trusted me last year. So 5 years of not knowing really what's wrong with me, and like and I just like become so secluded that I cut off everyone. Yeah, I just don't want to hear it. Like I don't want to hear oh, there's nothing wrong with you, like why are you limping, why are you in pain, like tell me your story. Like I don't want to tell you because everyone thinks I'm insane.
Yeah, and that's how it's so damaging, because then you're just super isolated and then become depressed, and then it's like this whole cycle that you can't get out of because you don't want to go through it again, and it's terrible. It's a terrible cycle.
I hate it so much.
Yeah, I do too. I'm the same way. So it's like God damn it, because someone will ask you and you're like, no.
Yeah.
No, thanks.
Literally, like, that's like the biggest thing. Like, I stopped limping. Like, I would stop limping because I don't want people to ask me, because like, so like my joint pain can come on like anytime. Like, I could like be walking, be fine, and then all of a sudden like there's like a really sharp pain that I'm having, and like it would be there for like maybe like a minute or two, a limp for a second, and then like I go back to normal. And I just want people to like think that like I'm like, it's weird because like you see me walking fine and then I start limping and then I walk normal again. Like, it's just weird. Like, people don't understand because then you think they think you're faking it. Like, that's a big thing for me, is like people think I'm faking it. And like, and then like if I do have pain and I limp for a lot longer and they ask me, oh, what's wrong? I just don't want to tell you my whole story. It's 6 years of it's a lot of information.
Yeah.
Like I just say, honestly, I just like, I have chronic pain. There's nothing you can do for me. Like, you can't give me pain medication because pain medication doesn't work. You can't like, there's like no ice packs don't work. Heating pads like help a little bit, but like there's nothing you can do. Stop. Like, just stop. Like, I appreciate it, but it's just too much.
Yeah, exactly. And then it's hard because then people stop even wanting to talk to you, and it's just,
Yeah.
it just becomes this cycle of endless isolation. And just like, I feel like a lot of people are overwhelmed with emotion but then suppress it, like we talked about earlier, and it's just that's when it comes out randomly, and it's a vicious cycle and it never stops.
I think the biggest thing that I hate about all of this is how bitter I've become towards things. Like, you become like even though like I'm a happy, like, go lucky person at one point in my life, like I just become really like bitter and sour to a lot of things, and it's just not good because you want to be able to be happy and like find the happiness in the things, but
Yeah. It changed your personality from swimming, like happy, kind of outgoing, and then now everything kind of, like you said, bitter, and it's just not fun. So when did you kind of notice that change then, of viewing everything as like, oh, this is great, and then it's like all of a sudden everything is not, and everything kind of sucks and you don't want anything to do with it?
I think the end of 13, beginning of 14, like,
Yeah.
like especially like in middle school when I really started getting like bullied for like it's like really hard for me to like even use my accommodations for being bullied, because I remember just sitting in math class and like these 3 boys were just like laughing at me, and like because like I think because I was like using my iPad or whatever, I don't know, but like they were just like, everyone was sitting like there like making fun of me, and I just started crying, and I'm just like, I'm over this. Like, I hate people. Like, I don't want to be here. Like, and then like someone would be like using their iPad, the teacher would be like, turn that off, and they'd be like, oh, she gets to use her iPad, and like obviously they can't just like say, oh yeah, she has problems because like medical like security and stuff, but like it's just like hard because then people don't like you because you get to use special equipment because and they get jealous. I'm just like, well, do you want to live with my chronic pain? Like, do you want to take the burden? Because I'd rather not have these accommodations. Do you want the burden off my shoulders?
Yeah. And they don't get it because they're like, oh, she gets to use, that's cool. Like, but it's not cool, the whole story behind it.
Like, I'm sorry I can't write for you. Like, I'm sorry.
But yeah, exactly. It's frustrating. So I guess like, how did you kind of start viewing things that you used to view as maybe better than when it changed?
How did I start viewing things that are bitter? Like,
no, like better. I meant say better. I came out bitter. How did you start viewing things that were like used to be like happy and like you liked it, and then you kind of turned more bitter and kind of the sour view of some things?
So we're looking at the better view. So like I used to like cook a lot, that kind of like with my depression that went away, and then I'm like with like obviously like the past 6 months, like there's just been a lot of like change, like that's helped me a lot, and I've gone into like cooking again, and like being with friends. Like, I've actually like made like 2 best friends my junior senior year, and that like really helped me. Like, I like this girl, like it was a new girl at school, and like we just became like instant best friends. And that tremendously helped. And like I appreciate my friends because they ask about me and like they see how I'm doing, but they also don't make my whole life about it.
Yeah.
Yeah, I appreciate them a lot for it. Like they always ask, like, see how I'm doing, and like like they know, but they don't make my whole life about it. Like I don't want to live as the girl who's in pain all the time and like can't do things. And so yeah, I think the biggest thing is just like getting people in my corner. Like
Yeah. And those are really good people to have, where they understand, but they're not going to bring it up all the time.
Yeah. Like I didn't, like I said, like before, like I'm like I was like a lone wolf. I didn't have anyone.
Yeah.
And then like starting to like build, like get friends, have doctors that trust me, and then like I start like liking things again, like being going. And like honestly, if you said that if you had the Instagram story like 6 months prior, like if before that, I would not have answered because I'd been too scared. I would not have talked.
Yeah.
I would have reached out. This would not have happened.
Yeah, so that's kind of crazy to see like that growth then, even from just 6 months ago, by just getting the right people in your life.
Yeah.
I think that's a huge thing. So when you don't have the right people, like you said, you're just like, it's scary and you don't want to talk about it at all.
Yeah.
So that's really cool. Well, I think this is great. Great conversation. Is there anything else you want to touch on or that you can think of, or do you think you kind of covered?
I think, I think the biggest thing is just, I think we covered like the big things and just the like me being happily bubbly person when I was 12. That kind of went bad and sour. My mind went sour, and then I'm happy again. Like it does, like it's such a cliche thing to say, but like it will get better if you find, like, I don't know, like people will help you. Like you'll find the right people, and it will get better. It took me 5 years. Like it takes time. It really takes time to heal.
It really does.
It will get better. I feel like, and also like me being older and getting more perspective on things has really helped too. Like I just things will get better. Go to therapy if you want to.
If you want to. Yeah.
Try it out. Try new things. That's all I gotta say. Yeah. Like I think that's the biggest thing for me is trying new things and like actually like becoming more outgoing. It's really helpful.
Well, that was great because I like seeing the change, like from going up, like happier, than down, and coming back up. So that kind of gives like probably a sense of this can happen. Like you can find things that help, and
it's not gonna be easy. I will mention that it's not gonna be easy. It's not gonna be easy.
Not at all. It did not sound easy from your stories you were telling at all. It definitely is not easy, but I think you're a good example of how you can get there.
Yeah.
Especially when it gets really, really bad. So
yeah,
that was great. So thank you. And I guess if you have nothing else.
I'm good.
No? Okay, good. Well, thank you. And we'll say goodbye then.
Bye.
Bye.